sure it's recording. 2, 3, 4, 5, 6. We have a saying in the EMS field when we're called to a drowning, and it is, our patients are not dead until they're cold and dead. I know this may sound terrible, but what we're saying is that when patients are in cold water, they have a much better chance of survival. Cold can be a good thing for the body under certain circumstances. There have been many advances in the uses of therapeutic hypothermia. It has evolved from being used in surgery rooms and hospitals to now being performed on patients with a return of spontaneous circulation after a return of a pulse after cardiac arrest. I'm a paramedic and have watched firsthand the rapid evolution of therapeutic hypothermia in the medical field. First, I will tell you about the history of therapeutic hypothermia. Next, I will detail exactly what this therapy is. And then I will explain the benefits of this treatment. And lastly, I will tell you about the growth this therapy has had. First, the history of therapeutic hypothermia. Therapeutic hypothermia has been around for many years. Greek physician Hippocrates, from which the term the Hippocratic Oath came from, advocated the packing of wounded soldiers in ice and snow because it believed that it increases their chance of survival. In 1930s, Germany experimented with hypothermia in prison camps to learn the effects about cold water on downed airmen. And in the 1950s, hypothermia began to be used in hospitals in open heart surgeries to protect the brain. Next, I will explain exactly what therapeutic hypothermia is. Therapeutic hypothermia is essentially lowering a patient's body temperature after having a cardiac arrest and then having a return of a pulse after CPR. The target temperature to cool a patient is between 32 and 34 degrees Celsius and must be done within 120 minutes. This is difficult, so it must be initiated quickly. There are a variety of techniques used for this procedure. In the EMS field, we use non-invasive procedures such as ice packs to the body, cold wet blankets or towels, and cooled IV fluids. In hospitals, they have more advanced invasive techniques and equipment that can cool patients internally, such as cooling catheters. Now we'll describe why therapeutic hypothermia is used on patients after a cardiac arrest. Through trials and continued research, therapeutic hypothermia has been shown to be an asset in the care of patients with a return of a pulse. According to an article in the New England Journal of Medicine, 75 of the 136 patients, which is 55% of the hypothermia group, had favorable neurological outcomes and a lesser reduced mortality rate. When hypothermia therapy is initiated, the cooling of the body reduces the oxygen demand of the brain, and it essentially gives it a rest. It also reduces the metabolic demand of the body. Finally, I will show how therapeutic hypothermia use is increasing in the medical field. Therapeutic hypothermia use is expanding in leaps and bounds worldwide. In 2011, the American Heart Association added mild therapeutic hypothermia as a treatment for the unconscious adult patient with a return of spontaneous circulation, which is a return of a pulse, in their updated ACLS guidelines. So they are also advocating the use of the therapeutic hypothermia. Hospitals and EMS are equally entwined in this therapy. More and more hospitals are now adding this treatment protocol to their this therapy to their treatment protocols, and with that, EMS agencies are now able to implement this procedure in the field because they now have more hospitals that they can transport patients to, and they can continue the therapy. To conclude, therapeutic hypothermia has an interesting history and is making a big impact in today's medical field. Today I have discussed how therapeutic hypothermia has had a long-standing history, what therapeutic hypothermia is, described why it is used on patients with a return of a pulse after a cardiac arrest, and stated how this treatment is rapidly growing. To end, I would like to say that working in the medical field has allowed me to see firsthand therapeutic hypothermia not only being used in hospitals but also on ambulances. And it will be interesting to see what the future holds for this treatment modality. show my audience one more time? Okay, thank you.